I'm here to explain Chapter 7, Document 1, Chapter 7, the immune response. Okay, we have once an antigen enters, we have two defense mechanisms. We have the immediate response, okay, the non-specific immune response, which is triggered within few hours after the invasion, and another delayed response, the specific immune response that needs days to occur. The specific immune response eliminates the intruders that escape the non-specific response and maintains a memory that allows it to attack them more efficiently, okay, when the same antigen re-enters again. So document 1, the non-specific immune response, page 138. Before we start with the non-specific immune response, how the body, how the first line of defense attacks the non-self antigen, I'm here to present some of the natural barriers of the body. Okay, document A shows the natural barriers. We have, if I want to define the natural barrier, these barriers are present to prevent the entry of microbes or of antigens. We have the skin, we have the sweat, we have the bacteria that lives in the mucosal lining, we have the mucosal secretions like the tears, saliva, we have the mucus, البلغم اللي موجود بالrespiratory system, بالlining of the respiratory system, and we have the acidity of the gastric juice and the vaginal and semen also, vaginal secretions and the semen also contain antimicrobial substances. So if I want to, if you want to classify these natural barriers into mechanical and chemical natural barriers, the skin, which is virtually impermeable to foreign substances and microorganisms, فإذن هي it's mechanical or physical. Sweat, بما أنه عم نحكي عن sweat و pH و destroy chemically, okay, the microorganisms, فإذا نحن عم نحكي عن chemical action. بكتيريا هون نحن عم نحكي عن a biological, it's not mechanical, not chemical. في يعتبر انه البكتيريا هيدي بتفرز chemical substances يلي هي بتمنع ال growth of another bacteria. في يعتبرها chemical وفي حيدها يعتبرها هي biological. Mucosal secretions, tears, saliva contain lysozyme, enzyme that can destroy many bacteria. So عم نحكي نحن عن chemical destruction. Mucus in the nasal and bronchus secretions protect the respiratory tract by trapping inhaled particles and microbes. So نحن عم نحكي عن trapping يعني عم بيحبس هيدا الميوكس بلقوة الميكروبس inhaled particles يعني ما عم بيعملهم destruction. So this is mechanical. Gastric juice destroy most ingested toxins and microbes. So this is chemical. And vaginal secretions and semen فيهم antimicrobial substances. So ضد الميكروب يعني chemical action. Okay, نحن بنكون حلينا part 1 بprobing the document, page 139. So a few hours after an injury, the infected wound becomes red and swollen and feels hot and painful. These same signs appear in the case of many infections, such as dental abscess, otitis, ear infection, pharyngitis, throat infection. عطول في عنا 4 signs of inflammation لازم يبينوا يلي هن redness, heat, swelling or edema, and pain. Okay? So أنا هعتبر إنه صار عندي دقتني شوكة إبرة وصار في opening بالسكين وهيدا الشيء أدى إنه يصير في عندي entry of the bacteria. هيدي البكتيريا دخلت لعند السيلز وعملت لهم دامج بمطرحة معينة. اوكي. البكتيريا أو الانفكتد cell by the bacteria secrete chemical substances أنا بسميهم cytokines. هدول السيتوكاينز عندهم many functions. رح يعملوا attraction لل white blood cells للماكروفاجز لحتى يوصلوا للsite of infection. رح يكون لهم تأثير على الدايليشن، يرفعوا التمبريتشر لحتى يصير في عندي dilation of blood capillary to increase the blood flow. كمان هن حيكونوا مسؤولين عن the migration of the white blood cells from the blood to the infected site. Okay. فإذا لازم نعرف إنه infected cells they release cytokines in blood والرول لهم increase the gap between cells of the blood vessels membrane facilitating diapedesis. If you remember نحن سميناها diapedesis the passage of a macrophage or granulocyte from the blood okay to the infected site. قلنا بتعمل squeezing وبتمرق حالها between two endothelial cells. Dilate the blood capillaries and increases the blood flow. Attract immune cells toward the inflammation area اللي هي عندها chemotactic effect. The four signs of inflammation اللي ذكرناهم قبل redness and heat. They are due to dilation of blood vessels, pain due to stimulation of nerves, swelling or edema. It's due to leak of plasma out of capillaries during the diapedesis of the white blood cells. So this is an animation.
The inflammatory response is an important nonspecific defense against tissue damage. It begins when injured tissue cells release chemical signals that activate the endothelial cells of nearby capillaries. Within the capillaries, adhesion molecules called selectins are displayed on the activated endothelial cells. These adhesion molecules attract neutrophils, slow them down, and cause the neutrophils to roll along the endothelium. As the neutrophils roll along the endothelium, they encounter chemicals that activate integrins, which are adhesion receptors on their surfaces. These integrins then tightly attach to adhesion receptor molecules on the endothelial cells. This causes the neutrophils to stick to the endothelium and stop rolling. This accumulation of neutrophils along the walls of the capillary is referred to as margination. The inflammatory mediators released by the injured tissue bring about changes in the environment that cause mast cells to degranulate and release histamine. Histamine causes vasodilation and an opening of the junctions between the endothelial cells, allowing fluid and leukocytes to leave the capillary and enter the infected tissue. The neutrophils now undergo dramatic changes in shape and squeeze through the endothelial wall into the interstitial tissue fluid. This process is called extravasation. The neutrophils, followed by other types of phagocytes, are attracted to the damaged site by chemotactic substances released by bacteria and tissue breakdown products. They ingest and destroy invading bacteria.
Okay.
The inflammatory
هلا بنشوف نحن الستبس اوف phagocytosis. نحن وصلنا انه الماكروفاج وصلت لعند البكتيريا. قلنا هدف الانفلاميشن او هدف كل هالانفلاماتوري رياكشن انه نحن نوصل الماكروفاجز to the infection site لعند البكتيريا لحتى نتخلص منها. The steps of phagocytosis هي الادهيشن عنا where okay to the antigen or to the bacteria. بعدين بصير في عنا engulfment, absorption, so تعمل مثل it stretches its arms كأنه بتسكر عليها للميكروب, and later we have digestion by certain enzymes. So in the first case, what if the macrophage fails to make phagocytosis for the microbe? We have different cases as it is presented in document C. The first case, أول شيء هيدي الماكروفاج قدرت تتخلص من الميكروب, so بقلي infection is stopped. Okay, it's the normal function of the macrophage. In the second case and in the third case, the second case ممكن يكون عندي enzymatic deficiency أو بتكون البكتيريا هي resistant للإنزيم, يعني ما بيقدر عليها الإنزيم, أو المشكلة بالإنزيم عندي نقص بالإنزيم بالكمية, نقص بوجوده للإنزيم. هيدا الشيء بخلي البكتيريا remains intact جوا الماكروفاج, وممكن بعدين شو تعمل multiplication inside زي ما أنا عم شوفها ب third case, multiplication of the bacteria. هيدا الشيء بخلي يصير في explosion عادي بتفجرها للماكروفاج أو للجرانولوسايت, and the granulocyte أو الماكروفاج will die. okay, فإذن هيدا الماكروفاج أو الفاجوسايت يا بتنجح بالفاجوسايتوسيس أو بكون عندها مشكلة بالإنزيم, أو البكتيريا أقوى من الإنزيم بتسبب إنه تبقى البكتيريا جوا الماكروفاج أو جوا الفاجوسايت. It might later multiply. If it multiplies حتعمل مثل explosion بالمايكروفاج أو بالجرانولوسايت leading to its death.
Neutrophils are white blood cells that hunt and kill bacteria. In this spread, a neutrophil is seen in the midst of red blood cells. Staphylococcus aureus bacteria have been added. The small clump of bacteria release a chemoattractant that is sensed by the neutrophil. The neutrophil becomes polarized and starts chasing the bacteria. The bacteria, bounced around by thermal energy, move in a random path, seeming to avoid their predator. Eventually, the neutrophil catches up with the bacteria and engulfs them by phagocytosis.
Why is phagocytosis referred to as a non-specific immune defense mechanism? ليش بعتبرها non-specific؟ لأنه الجرانولوسايتس الماكروفاجز ما عندهم receptors. They cannot bind to the antigen with a certain receptor. They act equally to all antigens. بيتعاطوا مع كل الانتيجنز بنفس الطريقة. ما في عندي مبدأ specificity مثل المفتاح والقفل. So لأنه they don't refer to the identity of the intruder, they react to all antigens equally. Formulate two hypotheses explaining how some foreign bodies may resist phagocytosis during the non-specific immune response. فإذا اللي حكينا عنهم قبل, ممكن يكون عنا نحن مشكلة بالإنزيم, يكون في عندي deficient enzyme, وممكن يكون البكتيريا is not recognized by the macrophages. ممكن تكون حتى البكتيريا is resistant to the enzymes. okay, فإذا we have many or few hypotheses we can put if ever the macrophages fails in its job. okay, ممكن يكون عندي البكتيريا is not recognized, في يقول البكتيريا is resistant to the enzymes, ممكن تكون مش موجود الانزيم, في deficiency بهيدا الانزيم.